Nursing exam difficult questions. Question 1. A nasogastric tube for suction is ordered for a neonate diagnosed with a diaphragmatic hernia. Which complication related to gastric drainage is the priority when planning care for this neonate? Weight loss, metabolic alkalosis, dehydration, hyperbilirubinemia. B. Metabolic alkalosis. Correct answer. In this case, the correct answer is B. Metabolic alkalosis. When a neonate with a diaphragmatic hernia is on nasogastric suction, excessive gastric drainage can lead to a loss of hydrochloric acid, resulting in metabolic alkalosis. This is the priority complication because it can have serious consequences on the neonate's overall health and well-being. Option A. Weight loss may occur as a result of gastric drainage, but it is not the priority concern compared to the acid-base imbalance that metabolic alkalosis presents. Option C. Dehydration is a possible complication due to fluid loss through gastric drainage. However, metabolic alkalosis takes precedence as it can have more immediate and severe effects on the neonate's physiological stability. Option D. Hyperbilirubinemia is not directly related to nasogastric suction or gastric drainage in this scenario and is therefore not the priority complication to address. Educationally, understanding the potential complications of nasogastric suction in neonates with specific conditions like diaphragmatic hernia is crucial for pediatric nurses. This knowledge enables them to anticipate, identify, and intervene promptly to prevent serious complications and provide optimal care for these vulnerable patients. Question 2. What is the priority nursing action when preparing a neonate born with a gastroschisis defect for transport to a pediatric hospital for corrective surgery? Covering the exposed intestines with sterile moist gauze. Wrapping the newborn warmly in 2 or 3 blankets. Providing sterile water feeding to maintain hydration during transport. Allowing the parents of the newborn to see their child prior to transport. A. Covering the exposed intestines with sterile moist gauze. Correct answer. The correct answer is A. Covering the exposed intestines with sterile moist gauze. This is the priority nursing action because the gastroschisis defect involves a hole in the abdominal wall, leading to exposed intestines, which are at risk for infection, dehydration, and heat loss. By covering the intestines with sterile moist gauze, the nurse can protect the organs from infection and prevent fluid loss. Option B. Wrapping the newborn warmly in 2 or 3 blankets is incorrect because while maintaining the newborn's body temperature is important, it is secondary to protecting the exposed intestines. Option C. Providing sterile water feeding to maintain hydration during transport is incorrect as neonates with gastroschisis are at risk for fluid and electrolyte imbalances. And providing water feeding without proper surgical correction can lead to complications. Option D. Allowing the parents of the newborn to see their child prior to transport is not the priority action, as the immediate focus should be on protecting the exposed intestines to prevent complications. In an educational context, this question highlights the importance of prioritizing interventions based on the immediate needs of the neonate with a surgical emergency like gastroschisis. It emphasizes the critical thinking skills required in pediatric nursing to provide safe and effective care for neonates with complex conditions. Question 3. A 4-year-old child is admitted to the hospital secondary to the nurse suspect based on the current data: hypernatremia, metabolic acidosis, hypotonic dehydration, isotonic dehydration. C. Hypotonic dehydration. Correct answer. The correct answer is hypotonic dehydration. The combination of high hemoglobin and hematocrit with low serum sodium indicates hypotonic dehydration. In this condition, there is an excess of solutes relative to water, leading to higher red blood cell concentration, elevated hemoglobin and hematocrit, and low serum sodium levels. Question 4. Which parental statement indicates correct understanding of preventive techniques for heat-related illnesses when children exercise? Wearing dark clothing during exercise is not recommended. Water is the preferred fluid for fluid replenishment. During activity, stopping for fluids every 15 to 20 minutes is essential. Hydration should be maintained throughout the exercise session. C. During activity, stopping for fluids every 15 to 20 minutes is essential. Correct answer. In pediatric nursing, understanding preventive techniques for heat-related illnesses in children during exercise is crucial. Option C. During activity, stopping for fluids every 15 to 20 minutes is essential is the correct choice. This statement reflects the importance of frequent hydration breaks to prevent dehydration and heat-related complications in children. During exercise, children are at a higher risk of overheating due to their smaller body mass and higher metabolic rate, making regular fluid intake vital. Option A, wearing dark clothing during exercise is not recommended, is incorrect because dark clothing absorbs more heat, contributing to increased body temperature during physical activity, which can exacerbate the risk of heat-related illnesses. Option B, water is the preferred fluid for fluid replenishment, is partially correct, but it lacks the specificity of timing and frequency emphasized in Option C. Option D, hydration should be maintained throughout the exercise session, is too vague and does not provide clear guidance on the frequency of fluid intake necessary to prevent heat-related issues in children. Educationally, emphasizing the need for regular hydration breaks during exercise sessions helps reinforce the importance of proactive measures in preventing heat-related illnesses in pediatric patients. This knowledge equips pediatric nurses to educate parents and caregivers effectively on best practices to safeguard children's health during physical activity, promoting optimal well-being and safety in pediatric populations. Question 5. In the morning, a healthcare professional receives change of shift report on 4 pediatric clients, each of whom has some form of fluid volume excess. Which of the children should the healthcare professional see first? The child with tachypnea and pulmonary congestion. The child with hepatomegaly and normal respiratory rate. The child with dependent and sacral edema and regular pulse. The child with periorbital edema and normal respiratory rate. A. The child with tachypnea and pulmonary congestion. Correct answer. The child with tachypnea and pulmonary congestion should be seen first as these symptoms indicate a more severe form of fluid volume excess that requires immediate attention. Tachypnea is an increase in respiratory rate, which could be a sign of respiratory distress, and pulmonary congestion indicates fluid accumulation in the lungs, posing a significant risk to the child's respiratory function. Question 6. When caring for a child with hyponatremia, a nurse delegates care to a licensed vocational nurse, LVN, and instructs the LVN to promptly report which clinical manifestation: seizures, respiratory distress, hyperthermia, bradycardia. A. Seizures. Correct answer. Seizures are a significant concern in severe hyponatremia as they indicate potential neurological complications and the need for urgent intervention to prevent further harm to the child. Prompt reporting of seizures allows for timely assessment and appropriate treatment to ensure the child's safety and well-being. Question 7. A child with croup has an increased PCO2, a decreased pH, and a normal HCO3 blood gas value. Which finding does the nurse report to the healthcare provider based on these data? Uncompensated metabolic alkalosis, uncompensated metabolic acidosis, uncompensated respiratory acidosis, uncompensated respiratory alkalosis. C. Uncompensated respiratory acidosis. Correct answer. In this scenario, the correct answer is C. Uncompensated respiratory acidosis. This is because the child with croup has an increased PCO2, respiratory component, a decreased pH, and a normal HCO3, metabolic component, blood gas values. Respiratory acidosis occurs when there is inadequate excretion of carbon dioxide, leading to its buildup in the blood, resulting in a decrease in pH. The normal HCO3 level indicates that there is no compensatory metabolic response to the respiratory acidosis. Option A, uncompensated metabolic alkalosis, is incorrect because the HCO3 level is normal, ruling out metabolic alkalosis. Option B, uncompensated metabolic acidosis, is incorrect because the HCO3 level is normal, ruling out metabolic acidosis. Option D, uncompensated respiratory alkalosis, is incorrect as the child's PCO2 is increased, indicating respiratory acidosis rather than respiratory alkalosis. In an educational context, understanding blood gas values and their interpretation is crucial for pediatric nurses to assess and manage respiratory conditions effectively. Recognizing the acid-base balance disturbances aids in providing appropriate interventions and collaborating with healthcare providers for optimal patient care. Question 8. For a 6-year-old child with hypokalemia, which menu choice should the nurse encourage? Pizza with a fruit plate, chicken strips with chips, fajita with rice, hamburger with French fries. A. Pizza with a fruit plate. Correct answer. In pediatric nursing, it is crucial to understand the nutritional needs of children, especially when managing conditions like hypokalemia. The correct menu choice, A. Pizza with a fruit plate, is the best option for a 6-year-old child with hypokalemia. Pizza provides a good source of carbohydrates, proteins, and fats while also being customizable to include potassium-rich toppings like vegetables. The fruit plate further adds essential vitamins, minerals, and natural sugars, which can help replenish potassium levels. On the other hand, options B, C, and D are less ideal for a child with hypokalemia. Chicken strips with chips, B, and hamburger with French fries, D, are high in unhealthy fats and low in potassium, which can exacerbate the condition. Fajita with rice, C, may offer some nutritional value, but it lacks the potassium content needed to address hypokalemia effectively. Educationally, this question highlights the importance of considering not only taste preferences, but also nutritional content when choosing meals for pediatric patients with specific health needs. It reinforces the significance of individualized care and the role of nurses in promoting healthy eating habits to support children's overall well-being. Question 9. The healthcare professional is completing the intake and output record for a child admitted for fluid volume deficit. The child has had the following intake and output during the shift: for ounces of Pedialyte, 1/2 of an 8-ounce cup of clear orange Jell-O, 2 graham crackers, 200 milliliters of D5 1/2 sodium chloride 4. Output: 345 milliliters of urine, 50 milliliters of loose stool. How many milliliters should the healthcare professional document as the client's total intake? Give the numerical answer only. Do not include any units of measurement. For 40, for 100, for 110, for 150. A. 440. Correct answer. In this scenario, the correct answer is A. 440. The healthcare professional should document the client's total intake by adding up all the fluids consumed by the child. The child consumed 4 ounces of Pedialyte, approximately 120 milliliters, 1/2 of an 8-ounce cup of Jell-O, approximately 120 milliliters, 2 graham crackers, minimal fluid intake, and 200 milliliters of D5 1/2 sodium chloride 4, totaling 440 milliliters. Option B, 400, is incorrect because it does not include the correct calculation for the intake of fluids. Option C, 410, is also incorrect as it does not account for the full intake. Option D, 450, is incorrect as it overestimates the total intake by including unnecessary calculations. Understanding how to accurately document a child's intake and output is crucial in pediatric nursing to monitor fluid balance, detect dehydration or overhydration, and assess the effectiveness of treatment. It is important for healthcare professionals to be meticulous in their documentation to ensure optimal care for pediatric patients. Question 10. As a result of opioid administration, a child's respirations are slow and shallow. Which should the nurse anticipate when assessing the child's arterial blood gas? Increased PCO2 and respiratory acidosis. Decreased PCO2 and respiratory alkalosis. low pH and low PCO2, high pH and high PCO2. A. Increased PCO2 and respiratory acidosis. Correct answer. When a child's respirations are slow and shallow due to opioid administration, it results in hypoventilation. This leads to retaining carbon dioxide, indicated by an increased PCO2 level on arterial blood gas analysis, and subsequently causes respiratory acidosis due to the buildup of CO2 in the blood. Question 11. Which is the priority nursing assessment when providing care for an infant at risk for dehydration? Urine output, urine-specific gravity, vital signs, daily weight. D. Daily weight. Correct answer. In pediatric nursing, assessing infants at risk for dehydration requires a comprehensive approach to prioritize care effectively. The correct answer, D. Daily weight, is crucial because infants are more vulnerable to fluid imbalances due to their small size and rapid metabolic rate. Daily weight monitoring in infants can provide early indications of fluid loss or gain, helping to guide timely interventions. Option A. Urine output is important in assessing hydration status, but in infants, it can be variable and may not provide a reliable indicator of dehydration, especially in cases of insensible water loss. Urine-specific gravity, option B, is also a useful indicator, but may not be as practical or sensitive in infants compared to adults. While vital signs, option C, are important in assessing overall health, they may not be as specific indicators of dehydration in infants as changes can be subtle and easily missed. Daily weight monitoring is a more direct and reliable method to detect changes in fluid status in infants. In an educational context, understanding the rationale behind prioritizing daily weight assessment in dehydrated infants is crucial for pediatric nurses to provide safe and effective care. By emphasizing the significance of daily weight monitoring, nurses can proactively identify and manage dehydration in infants, ultimately improving patient outcomes and safety. Question 12. The patient with bipolar disorder is being treated with lithium and has a new prescription for captopril for hypertension. The combination of these two drugs makes which assessment particularly important? Potassium level, lithium level, creatinine level, blood pressure. B. Lithium level. Correct answer. When captopril, an ACE inhibitor, is combined with lithium, it can lead to lithium accumulation. Therefore, monitoring lithium levels is crucial to prevent toxicity. While ACE inhibitors like captopril can cause hyperkalemia, renal insufficiency, and hypotension, the risk of these effects is not increased by the combination of lithium and captopril. Question 13. A nurse administers naloxone, Narcan, to a post-op patient experiencing respiratory sedation. What undesirable effect would the nurse anticipate after giving this medication? Drowsiness, tics and tremors, increased pain, nausea and vomiting. C. Increased pain. Correct answer. In this scenario, the correct answer is C. Increased pain. Naloxone is an opioid antagonist used to reverse the effects of opioids, such as respiratory depression. When naloxone is administered to a patient who is opioid dependent or has received opioids, it can precipitate acute withdrawal symptoms, including increased pain due to the sudden reversal of the analgesic effects of opioids. Option A. Drowsiness is incorrect because naloxone typically causes alertness rather than drowsiness. Option B. Tics and tremors are also not expected effects of naloxone administration. Option D. Nausea and vomiting are more commonly associated with opioid use rather than naloxone administration. In a pediatric nursing context, it is crucial for nurses to understand the pharmacological actions of medications they administer, particularly in critical situations like post-operative care. By recognizing the potential effects of naloxone, nurses can anticipate and manage adverse reactions effectively, ensuring the safety and well-being of their pediatric patients. Question 14. During a home care visit for an infant diagnosed with gastroesophageal reflux, which parental action observed requires intervention by the nurse? The infant's formula is mixed with rice cereal. The mother positions the infant in a high Fowler position while feeding. After feeding, the infant is placed in a car seat. The mother administers ranitidine, Zantac, to the infant using a syringe. C. After feeding, the infant is placed in a car seat. Correct answer: placing an infant diagnosed with gastroesophageal reflux in a car seat after feeding can increase the risk of reflux and aspiration. The semi-upright or high Fowler position is recommended to help reduce reflux symptoms during feeding. Adding rice cereal to formula can help thicken it and reduce reflux episodes. Administering ranitidine using a syringe is a common method of oral medication administration. Question 15. A toddler is admitted to the surgical unit for a planned closure of a temporary colostomy. Which medical prescription should the nurse question? Clear liquids today. NPO tomorrow. Type and cross-match for 1 unit of packed red blood cells. Rectal temperatures every 4 hours. Start an intravenous line with D5NS at 20 milliliters per hour. C. Rectal temperatures every 4 hours. Correct answer. In this scenario, the correct answer is C. Rectal temperatures every 4 hours. The nurse should question this prescription because taking rectal temperatures in a toddler who is scheduled for a colostomic closure can introduce the risk of infection due to the proximity of the surgical site to the rectum. Option A. Clear liquids today. NPO tomorrow is appropriate as it follows the standard preoperative fasting guidelines to prevent aspiration during surgery. Option B. Type and cross-match for 1 unit of packed red blood cells is also a valid prescription as it is essential for preparedness in case the toddler requires a blood transfusion during or after the surgery. Option D. Start an intravenous line with D5NS at 20 milliliters per hour is a common preoperative order to maintain hydration and provide glucose support during the perioperative period. In an educational context, it is vital for pediatric nurses to understand the rationale behind each medical prescription to ensure the safety and well-being of their young patients. Questioning orders that may pose risks or are not in the best interest of the child is a crucial aspect of advocating for pediatric patients' health and safety. Question 16. While caring for 4 different pediatric clients, which child is at the highest risk for dehydration? 7-year-old child with migraine headaches. 4-year-old child with a broken arm. 2-year-old child with cellulitis of the left leg. 18-month-old child with tachypnea. D. 18-month-old child with tachypnea. Correct answer. In this scenario, the 18-month-old child with tachypnea, rapid breathing, is at the highest risk for dehydration. Tachypnea can lead to increased respiratory rate, which can result in excessive loss of fluids through respiration, potentially causing dehydration. Option A. A 7-year-old child with migraine headaches is less likely to be at high risk for dehydration unless vomiting is a significant symptom. Option B. A 4-year-old child with a broken arm is not directly related to dehydration risk unless there are complicating factors like prolonged immobilization. Option C. A 2-year-old child with cellulitis of the left leg might have localized infection but not necessarily higher dehydration risk unless it leads to systemic symptoms like fever and poor intake. In a pediatric nursing context, understanding the signs and symptoms of dehydration in children is crucial for appropriate assessment and intervention. It is essential to recognize high-risk factors like tachypnea in infants and young children, as they are more vulnerable to fluid imbalances due to their smaller body size and higher metabolic rate. Early identification and management of dehydration are vital in pediatric care to prevent complications and promote optimal health outcomes. Question 17. The healthcare provider is assessing an infant brought to the clinic due to diarrhea. The infant is alert but has dry mucous membranes. Which additional assessment data indicates to the healthcare provider that the infant is experiencing an early to moderate stage of dehydration? Bradycardia, tachycardia, increased blood pressure, normal fontanelles. B. Tachycardia. Correct answer. Tachycardia is a common early sign of dehydration in infants, especially when presenting with dry mucous membranes and diarrhea. The increased heart rate is the body's compensatory mechanism to maintain cardiac output in response to dehydration. Bradycardia, increased blood pressure, and normal fontanelles are not typically associated with early to moderate dehydration in infants. Question 18. The healthcare provider is caring for a child on bed rest who has severe edema in the left lower extremity due to blocked lymphatic drainage. Which nursing diagnosis would take priority? Risk for impaired skin integrity. Risk for altered body image. Risk for imbalanced nutrition, less than body requirements. Risk for activity intolerance. A. Risk for impaired skin integrity. Correct answer. The priority nursing diagnosis in this scenario is risk for impaired skin integrity, because severe edema in the left lower extremity can lead to compromised circulation and pressure ulcers, increasing the risk of skin breakdown and infection. Addressing and preventing impaired skin integrity is crucial for the child's overall health and well-being. Question 19. A healthcare provider is planning care for a child with hyperkalemia. Which manifestation associated with the documented hyperkalemia requires immediate intervention by the healthcare provider? Hyperthermia, respiratory distress, seizures, cardiac arrhythmias. D. Cardiac arrhythmias. Correct answer. In hyperkalemia, cardiac arrhythmias are the most critical and life-threatening manifestation that requires immediate intervention. Hyperkalemia can lead to dangerous heart rhythm disturbances, potentially resulting in cardiac arrest. Prompt treatment is essential to stabilize the heart rhythm and prevent life-threatening complications. Question 20. The nurse is expecting the admission of a child with severe isotonic dehydration. Which intravenous fluid prescription does the nurse anticipate for this child? 0.9% normal saline NS. D5 0.2%, 1/4, normal saline. D5W, albumin. A. 0.9% normal saline, NS. Correct answer. In pediatric nursing, understanding fluid and electrolyte balance is crucial for providing safe and effective care. For a child with severe isotonic dehydration, the appropriate intravenous fluid prescription would be 0.9% normal saline, NS, which is isotonic and helps to expand the intravascular volume without causing a shift in fluid balance across the compartments. Option A is correct because 0.9% NS closely resembles the electrolyte composition of extracellular fluid, making it the most suitable choice for isotonic dehydration. This solution helps to restore fluid volume without causing significant changes in electrolyte concentrations. Options B and C are incorrect. D5 0.2%, 1/4, normal saline, and D5W are hypotonic solutions, which could worsen the child's condition by causing fluid to shift into the cells, leading to potential complications like cerebral edema. Option D, albumin, is a colloid solution that is typically used for specific situations like severe hypoalbuminemia or certain cases of shock. It is not the first-line treatment for isotonic dehydration in children. Educationally, this question highlights the importance of understanding the principles of fluid and electrolyte balance in pediatric patients. It emphasizes the need for nurses to select the appropriate intravenous fluids based on the child's clinical condition to prevent adverse effects and promote optimal outcomes. Question 21. A child is admitted to the hospital for hypercalcemia and is placed on diuretic therapy. Which diuretic would the nurse expect to administer? Furosemide, Lasix, hydrochlorothiazide, Aquazide, spironolactone, Aldactone, mannitol, Osmotrol. A. Furosemide, Lasix. Correct answer. Furosemide, Lasix, is a loop diuretic that acts on the ascending loop of Henle in the kidney to increase calcium excretion. In the setting of hypercalcemia, where there is an elevated level of calcium in the blood, Furosemide can help promote the elimination of excess calcium through the urine, thereby aiding in the management of hypercalcemia. Question 22. A child is being treated for dehydration with intravenous. The nurse is double-checking the flow rate the healthcare provider prescribed. The formula the healthcare provider used was for maintenance fluids, 1,000 milliliters for 10 kilograms of body weight plus 50 milliliters for every kilogram over 10 for 24 hours. Replacement fluid is the percentage of lost body weight times 10 per kg of body weight. According to the calculation for maintenance plus replacement fluid, which hourly flow rate will the nurse implement for 24 hours? 88 milliliters per hour, 86 milliliters per hour, 81 milliliters per hour, 83 milliliters per hour. B. 86 milliliters per hour, correct answer. In this scenario, the correct answer is option B, 86 milliliters per hour. The healthcare provider's formula combines maintenance and replacement fluid requirements. For maintenance, it is 1,000 milliliters for the first 10 kilograms of body weight and 50 milliliters for every additional kg over 10. For replacement, it is the percentage of lost body weight, 7% in this case, multiplied by 10 per kg of body weight. Option A, 88 milliliters per hour, is incorrect as it does not consider both maintenance and replacement fluid needs accurately. Option C, 81 milliliters per hour, and option D, 83 milliliters per hour, are also incorrect because they do not account for the total fluid requirements based on the child's weight and the percentage of weight lost. Educationally, understanding fluid balance calculations in pediatric nursing is crucial for providing safe and effective care to children, especially when managing conditions like dehydration. Nurses need to accurately calculate and administer 4 fluids to prevent complications associated with fluid imbalances. This question reinforces the importance of precise calculations in pediatric nursing practice to ensure optimal patient outcomes. Question 23. Why is the specific gravity for infants lower than for older children? Infants have a greater body surface area. Infants have a higher basal metabolic rate. Infants have a greater percentage of body weight that is water. Infants' kidneys are less able to concentrate urine. D. Infants' kidneys are less able to concentrate urine. Correct answer. The correct answer is D. Infants' kidneys are less able to concentrate urine. This is because infants have immature renal systems compared to older children. The developing kidneys of infants are not as efficient at concentrating urine, leading to a lower specific gravity. Option A, infants having a greater body surface area is not directly related to specific gravity, but is more linked to heat regulation and drug absorption. Option B, infants having a higher basal metabolic rate is also not directly related to specific gravity, but refers to the rate at which the body uses energy at rest. Option C, infants having a greater percentage of body weight that is water is partially correct, but does not fully explain the lower specific gravity. While infants do have a higher percentage of body weight as water, the main reason for the lower specific gravity is the immaturity of their kidneys. In an educational context, understanding the differences in renal function between infants and older children is crucial for pediatric nursing. Nurses must be aware of the physiological differences in order to provide appropriate care and monitor the hydration status of infants effectively. This knowledge helps in assessing and managing fluid balance and kidney function in pediatric patients. Question 24. A patient is prescribed lisinopril as part of the treatment plan for heart failure. Which finding indicates the patient is experiencing the therapeutic effect of this drug? #error. Potassium level of 3.5 milliequivalent/L. Crackles in the lungs are no longer heard. Jugular vein distension. C. Crackles in the lungs are no longer heard. Correct answer. Because ACE inhibitors promote venous dilation, they provide the therapeutic effect of reducing pulmonary congestion and peripheral edema. Absence of previously heard crackles would be an indicator of effectiveness. Edema and jugular vein distension are manifestations of heart failure. A potassium level of 3.5 is a normal value. Question 25. The nurse is preparing to administer a daily dose of digoxin. What is the priority nursing intervention? Analyze HR and rhythm. Assess for Hohmann's sign. Check BP. Palpate the pedal pulses. A. Analyze HR and rhythm. Correct answer. In pediatric nursing, administering medications like digoxin requires a thorough understanding of the drug's effects on the body, especially the cardiovascular system. The priority nursing intervention before administering digoxin is to analyze the heart rate and rhythm. This is crucial because digoxin is a cardiac glycoside that primarily affects the heart, and a change in heart rate or rhythm could indicate toxicity, which requires immediate intervention. Assessing for Hohmann's sign, option B, is not relevant in the context of administering digoxin, as it is a sign of deep vein thrombosis, unrelated to this medication. Checking blood pressure, option C, and palpating pedal pulses, option D, are important assessments, but are not the priority before administering digoxin to a pediatric patient. Educationally, understanding the rationale behind prioritizing assessments before administering specific medications enhances a nurse's clinical judgment and ensures safe and effective care for pediatric patients. It emphasizes the importance of focusing on assessments directly related to the medication's potential effects, thereby preventing adverse outcomes.